This podcast is intended for educational purposes only and is not medical or legal advice. Always follow your local policies, procedures, and protocols when functioning in your respective profession. Additionally, the views expressed by the speakers and owners of this podcast are their own and do not represent the views of their respective employers. Listener discretion is advised.
Alert Medic 1 response.
Ken, Josh, and Mustafa here. Welcome back to the Alert Medic 1 podcast. Well, welcome back, everybody, to the Alert Medic 1 podcast. Tonight, we've got myself, Ken, and Cody on, and we got a special guest, Cody's brother, Ryan, all the way coming from Alabama. Ryan, would you like to introduce yourself?
Yeah, like I said, my name's Ryan Winniford. I currently sit as a training NCO, Medlog Sergeant for a soft unit in the National Guard. I'm a 68 whiskey by trade in the Army. I've been in the Army off and on since 2004. I've got about 12 years active duty time accrued. Went to EMT school in 2007 and I have been involved in ambulance care, working on the volunteer fire departments. Was an EMT on a hotshot crew on an engine in the Angeles National Forest, and that brought me back to the Army after a little bit of break doing that. So I've got some combat medic experience. I've got some civilian EMS experience. Got some tactical EMS experience. So and that kind of all put me right in the CIM now.
Awesome.
For the record,
Awesome.
It's my little brother.
So, what are we talking about tonight? What we're going to talk about tonight, guys, is military medicine. Not so much, about maybe the joint trauma system or specific things that go on in military medicine, but more about how people can get into it, how people can join and become an Army medic, a Navy corpsman, or an Air Force medical tech, and how the training that we receive or that those people receive can help in transitioning, and how you can transition that certification into a job coming out of the military. And then a hot button issue that is at least in the Army medicine, that just because you're a combat medic in the Army does not mean you're a paramedic, and what that actually entails and personal experiences we all have, the three of us have with that. So starting off, for Army medicine, to become an Army medic, you're going to want to go down to your local recruiter, knock on the door, start talking to them, and be dead set on wanting to be an Army medic. There's some specific qualifications, GT scores, ASVAB scores, stuff like that you're going to need to pass and get certain scores on. But if you attain those, you go on to Army medic, you go to basic, then you're going to go to Fort Sam Houston. And that's where all military medicine, at least at the enlisted level and most of the officer level, is made in the United States. You're going to be looking at about 6 months at San Antonio, 5 to 6 months, depending on where you fall in the pipeline of training. Sometimes you get held for a month, like I did in reception, waiting for pickup. Yeah, it's a long story. And, young Private Josh Cook didn't understand the ways of the Army medical system and the Army admin system. I could have jumped ahead, but, it placed me where I am today. Everything happens for a reason. I sat in golf company for a month and hated my life. Those Army medics that are listening completely understand that statement. So you're going to start off in NREMT. That's going to be 8 weeks. It's going to be a crash course of EMT. You're going to learn everything out of the book, just like every other civilian EMT does. At the end of it, you're going to test for your NREMT. You're going to do your psychomotor. You're going to do your cognitive. And as long as you pass that, you get to move on to the next phase. Not all pass it. And if you don't pass after a couple retries, guess what? Needs of the Army. You're going to be kind of shot out to whatever they need. Truck driver, petroleum specialist, administration specialist, whatever it is. And then you're going to go down to what they like to call Whiskey Land. And Whiskey Land is where one of the first steps in diverting away from being an EMT happens in Army medicine. And you're going to learn to be a combat medic. Unfortunately, sometimes you do get hey, we're not going to we're not going to care about what we learned up the hill at EMT. We're going to only care about this because this is what makes Army medics. And that does influence some of the transition later on, and also this thought of Army medics or paramedics, or very much equivalents.
Yeah, and that EMT course is a beast, man. It's 6 weeks. You've got 6 weeks to get through. At least when I went through, my only one that I went through when I started, it was 91. Are you guys both? Did you guys both start at 68?
Yeah, I'm a 68.
So after the transition, yeah. So no, it was crazy. But that my understanding is that standard still hasn't changed. You get like first 6 weeks is EMT basic, and don't mess it up. Man. You don't move forward to do the cool guy stuff after that.
Yeah, you can challenge the national test if you have a state card. That was my issue. I had a state card, not a national card, because at the time Maryland was not a national state or nationally recognizing state. And I got the run around that, oh, well, we're going to have to find you a testing site somewhere in San Antonio, and the logistics of getting you there, and I don't know how we're going to do that in time, and you never know when you're going to get picked up. Well, dumb private cook thought, oh man, my hopes are shot. Well, the testing center is on base, guys. Okay, it's literally like 500 yards from where I was standing when I was told this. So it's not this logistical nightmare. They literally just had to find a time for me to take a test down there. But you can advance ahead if you have a national card, and you'll go right to 68 Whiskey, the combat medic portion, and you'll chop off about 3 months of your time at San Antonio. But they try and get that stuff ahead of time. But yeah, once you get into the whiskey phase, at least for me, it was a lot of fun. You get to learn how to be an Army medic. You do a lot of trauma, a little bit of limited primary care. That's the first block, and then after that, it's all tactical combat casualty care, doing crikes, tourniquets, IVs. You get stuck more times than you wish to be stuck by people that know how to stick. And so there you start to learn what it is to be an Army medic. And they like to say that, like, once again, that it's all about the trauma. I don't know about you, Ryan. When you went through, it was probably the same.
Yeah, so I went through it's slightly different from you guys. I went through as a reclass as an NCO, and I went to the satellite in Camp Shelby, Mississippi. So I did not have the Fort Sam Houston experience. Similar, though, very similar. I will say that 68 Whiskey, and I'll circle back to something you said earlier. 68 Whiskey, I don't know if it was this FY or the next one, but they're going to go from EMT basic to AEMT. So when you graduate, you have to be advanced EMT basic, which I think is good for the soldier that's going into that program. It helps them for the future. But I still had the EMT, which I did both times I went through EMT school was right at 30 days. So I've gone through the gamut with that. I've not had a semester of college to do any of my medical education like most. So anyway, yeah. But EMT school to the limited primary care to field craft, the medical field craft, and then it was all trauma lane, FDX after. You could see the gaps, and I would say I had some great instructors and I had some that weren't so great, but you could definitely see the gaps in experience and knowledge when they got into primary care, because that's where you see an Army medic who has done just Army medic stuff until they're now having to be forced to teach. And I had, just the background. I'd gone to nursing school and paramedic school, was not successful with either, but I had some experience. And being able to see the crosswalks between Army medic, paramedic, nursing. Yeah, I was good at some things with nursing, good at some things with paramedic. But the big vacuum there for me has always been primary care. And you might be able to speak to this from active duty standpoint. PA at the battalion level, once you graduate and get through all that stuff, all through the schoolhouse, your battalion PA and your senior medic, whoever that is, that's who makes, in my opinion, that's who sets the tone for your future. If your PA is super engaged and wants to teach and wants to talk, good for you. If he's just going to sit in sick call and go work shifts at the hospital an hour away, bad for you. But that's kind of what you get. It's not the schoolhouse that makes the medic. It's the leadership downrange on the line, the environment they end up in. You could go to an infantry battalion to work in the BAS. You could end up in a a cache like Cody was for a point. And those are widely different. But they all start, yeah, you're right. They all start there in San Antonio.
Don't
Yep.
forget the motor pool medics, man. Don't forget the
Oh,
motor pool
yeah.
medics.
Yeah.
So,
And you talked about the satellite sites. Shelby, I don't know if it still is one. There's another one on the East Coast at Fort Indiantown Gap.
and there's
That's where I did another one.
Camp Dodge, Iowa, I think is the other. So,
Yep. And I think there was one in Montana or North or South Dakota.
that's
A
right.
flight,
There is one at Fort Harrison, Montana. Yeah.
yeah,
There
a
is.
flight medic friend of mine went through that when he reclassed from infantry to medic.
Yeah.
But when you go into the Guard in the reserves, and if you are coming from active duty, you can reclass into those and then go to the satellite courses. It's shorter. It's a little bit different. Like I said, Fort Indiana Gap, that's where I drilled at for 6 years in the reserves. So it was right down the street. I saw them all the time. I knew a couple people that went through the course in various aspects. So yeah, San Antonio is not the only option. Sometimes it is what happens. It is where you end up. But yeah, it's interesting. The limited primary care. I look back and it's crazy because the limited primary care is a lot of what a lot of medics in the Army do, and it's kind of pushed away after AIT. Like you said, if you have a good PA, then you get engaged. You're good. When I was in the infantry, I did not have a PA. We had one that was chalked to us for a FTX, and then the rest of my battalion went downrange, and my company was back in rear D, unfortunately. But we didn't have a PA, so I didn't get a whole lot there. And then when I moved to Charlie Med and the BSB, all the docs were up at the clinic. We would do stuff in the field, but I became what Cody just said, a motor pool medic, basically, during the week. We didn't do any medical training, and that kind of leads into our next portion of the talk about transitioning, and I guess the mentality of how medicine is looked at by military medics. But before we get there, I really want to hit quick for those that are listening that maybe not interested in Army medicine, but Air Force and Navy medicine. You're gonna. Oh, Ken, you got a question?
Yeah. There's a lot of jargon and stuff flying around, and I'm not really following, to be honest with you. But one of the major confusing points: what is primary care? Is that like medical treatment? Is that like patient assessment? Like, what are you guys talking about?
So limited primary care is like your sick call, your urgent care medicine, essentially. Like it's talking about strains, sprains, breaks, skin conditions.
Yeah, stomach hurt. Is anything that they need outside of combat that you're supposed to be able to provide?
Yeah, and it's a 2-week portion of 68 whiskey where you have a book that you go through the whole thing, and it's a lot of EMT, a lot of stuff from EMT applied into like, hey, you've got this soldier that comes in complaining of, we'll just say their feet hurt, and you've been out in the field a while. Okay, I've been changing your socks. Oh no, you've been in immersion. You've got immersion foot or trench foot. You've got cellulitis. You've got whatever it is, and it's identifying those things. It's making you able to show up on day one at your unit and go in and run sick call as a brand new medic. And sick call, for those that don't understand, sick call is basically urgent care for the military. It's within your unit. And in the morning during physical training, you can go to sick call and get seen, and they can refer you to have to go to the main clinic, which is where the PAs, doctors, PT, whole bunch of different other specialties are at for your overall unit or area on the base. It's a kind of archaic system, but that's a whole other discussion for another time. And thanks, Ken, for pointing out that there's been a lot of jargon. We apologize for that. We got into our own minds, our own experiences, and started saying all the words that maybe you guys don't understand. If you have any questions, reach out to us, obviously, about what we're asking or what we're saying. But anything else, Ken?
Probably. What about a 68 whiskey? Is that a place? Maybe you said it and I missed it earlier.
No,
Just
That's what
Cody.
this is.
68 whiskey. So all of, at least in the Army, the military occupational specialty, or MOS, or my job, because I don't say medic, I say 68 whiskey to those. It's just an alphanumeric for every job in the Army. 11 Bravo is infantry, 19 Delta is cav, 88 Mike's truck driver. It's just an alphanumeric to identify your career field and your specific job.
Yeah. Each service has different names and different alphanumerics or however they number it. For example, in the Navy, a corpsman that works, or corpsman, which is a medic in the Navy, who works with the Marine Corps, so they're assigned to the Marines, is an 8404. It's a field corpsman.
Fair enough.
I don't know what their overall number is for corpsman, but then the Air Force has another alphanumeric for it, and it's just how we classify, like within our records, what we are. So you look at our records and you see that my primary MOS is 68 whiskey. I had friends that were 42 Alpha, like Ryan was bringing up the other names. 42 Alpha was an admin clerk. Stuff like that. And it's just a way to figure out where people go for training, where they fall within for promotions, movement between units, staffing and manning levels. The big Army looks and says, okay, well, this unit needs this many 68 whiskeys. So we're going to assign through human resources these 68 whiskeys to that position. And we're going to have them move to that location, wherever it is in the United States or even the world. But same thing with any other job, and any other service does the same thing as well. They look at the manning levels and figure out where people need to go based on their job duty and title. So, anything else, Ken? You are the.
I'm sorry.
You are the audience that we need to be catering to better with our, the first 15 minutes of this.
Yeah, you're good, man. It's been a great conversation. There's just little bits and pieces that I've been like, I'm not quite sure what's happening here. But no, I'll let you guys go on with your talk here. It's been great so far. I just feel like I'm over in my own little corner up here. Like, okay,
we're gonna try and keep the jargon down. We'll try. So the Navy and Air Force, real quick. Same process. You're going to go to your recruiter. You're going to talk to them. You're going to go and take the ASVAB. We said that earlier. That's your test to see what you qualify for at job-wise in the military. Imagine an SAT. That's what it is. It's an SAT with some stuff on electrical, some stuff on math, reading, comprehension, fitting shapes into certain things. It just determines what you're best at. And then that will help determine what jobs you get. So with the Navy, you're going to go to boot camp out in Great Lakes. I believe it's 2 months. And then you're going to go from there to San Antonio once again. That's where military medicine is created. And you're going to go to what's called A school. That is what they call their AIT, which is Advanced Individual Training in the Army. It's where they learn their job. And so they're going to go there and they'll learn to be hospital corpsmen. So hospital corpsmen can do a variety of jobs just like Army medics, but a lot of them work within a clinical setting of a hospital or the aid or the medical section of a ship or a boat. And so a lot of them just learn how to manage patients on a floor or within a clinic, stuff like that. But then they can also apply to become corpsmen with the Marine Corps and their fleet medical corpsmen. And then they can end up in clinics and in medical sections on ships, but they can also be with the infantry, with the different components of the Marine Corps providing medical care, because the Marine Corps does not have their own medical providers. It is all provided by the Navy. And from there, not just from there, in the Navy, You do not get an NREMT. You do not become an EMT basic out of training. All their training is in-house, but you are allowed to challenge the NREMT. And then you have to find a refresher course somewhere local to your base to then finish out the process of your psychomotor and your cognitive exam for NREMT, which unfortunately sets a lot of sailors up, corpsmen specifically, to not have the same job opportunities coming out of the service as the Air Force and Army medics. It's more work. The Navy provides a way to pay for it. You don't have to pay for it out of pocket, but it's an extra step before getting out, and you have to find the time and allow your command to give you the time to do the things to get it done. And sometimes that's not possible. But there is an option for those of you, if you're still in the Navy out there, or if you're going into the Navy, to get this done. And there are some pretty cool opportunities within the Navy, within medicine in general, that include search and rescue air crewmen, special reconnaissance marine or reconnaissance corpsmen, which work with force recon, and then that was quite the loud pull.
Sorry.
So there's a lot of great opportunities that spawn some different training and opportunities for getting different certifications. But like I said, up front, you do not get an EMT certification. And then the Air Force, once again, right back to go to the recruiter, take your ASVAB, qualify for it, and you're going to go to basic military training at Lackland Air Force Base in Texas, right outside of San Antonio. If you're going to be an Air Force medical tech, which is an Air Force medic, you're going to then hop on a bus, quite literally a bus, and drive the 20 minutes down to San Antonio or to Fort Sam Houston and start training there to be an Air Force medical tech. They do become NREMT qualified or certified, and they have to maintain it just like the Army medics throughout their time to maintain their job code. And so you do come out with your NREMT. So the same process would happen for you coming out of the Air Force as it would coming out of the Army to become an EMT in the civilian sector. Once again, they also have a lot of cool opportunities to do different types of training as medical techs. You can become an aerospace medical technician, where you get to fly on like C-130s and C-17s, the transport aircraft, and help out with medical evacuation squadrons. You can work in clinics. You can work in the hospital. If you so desire, you can go on to be, a cool guy, cool PJ guy, one of those guys, and get some other training along with it. But those are things that I'm only basic, familiar at the base level. If you want to learn more about PJs and more about our Air Force medicine, PJ Medcast is a good one to follow. They've been around for many years. They have a absolute plethora of episodes to pick from.
Yeah.
I think they're in their 300th. They're in their 300 realm, I think, right now.
Yeah, he's close. PJ Medcast is great for the PJ Medicine. If you want to know more about the pipeline and what it takes, One's Ready is the what they call it, the Air Force's official unofficial podcast. And they talk all special tactics stuff, of which PJs are a part.
Yep. But yeah, I mean that is the basic training there to be a enlisted medical provider in the armed services. I'm sorry, I don't have any information on how the Coast Guard does it. I would imagine that they send their corpsmen to San Antonio as well. But I don't know about getting an EMT certification or anything like that.
Nobody cares about those guys anyway. It's like, there's a Coast Guard too. Like every conversation you're having, like, those guys.
Looking back, they have some pretty cool jobs.
They do. And they do it in cool places.
Yeah.
Like when I'm on vacation and I look across and there's a Coast Guard base in the bay, I'm like, I took the wrong job. That's a beautiful spot.
Yeah. So talking about getting out and transitioning, we've all gotten out of the military and transitioned to civilian sector EMS at some point. The three of us have. My experience was pretty easy, personally. I came out with my paramedic card in hand. I got really lucky. I was able to go to a paramedic course while I was active duty. Way back.
I'm gonna light you on fire next time I see you.
Yeah. So way back in 2012, I want to say, the California Army National Guard did a test in Afghanistan where they deployed their National Guard aeromedical evacuation unit, or their dust off, with only critical care paramedics. So that was something that was brand new, and it only could be done there because they were all civilian, obviously outside of the National Guard. And so they wanted to test. Ken, you going to lose power, buddy?
It's possible. It's already happened once, so if I disappear.
Didn't know if it was that or Katie was calling to say, hey, dinner's ready or something.
Like flicking the light on and off. Like
it's a poltergeist up there.
Oh, yeah.
That's a different podcast.
Alert Medic 1 After Dark. But yeah, we've talked about it before, but off tangent. Yeah, they deployed with only critical care paramedics, and they studied the patient outcomes between EMT only dust off units, that's what it was up until about 2015, 2016.
2017 was the cutoff date for full transition.
Yep.
I think they launched in 15. I think you're right.
Yes, correct. And so they found out, surprise, surprise, patient outcomes are better when a critical care paramedic was in the back of the aircraft. This is both for quote-unquote scene flights or point of injury flights, where they were picking up critically injured soldiers from the battlefield, from the point of injury, and also the little-known side of dust-off in Afghanistan and Iraq, and now more than ever in large-scale operations that are possibly on the horizon, is taking patients that are sedated on a tube with head injuries, multi-system trauma, multiple drips, all kinds of stuff, crazy stuff, maybe balloon pump, possible drains in the head, all this stuff, and flying them from a little outpost in the mountains of Afghanistan back to a larger facility. And then that transition from, hey, they've possibly picked up this patient from the point of injury. Now they're taking them to the higher level of care after they've been stabilized. I'm just saying, I don't think there's any EMT that is ready to manage that patient in the back of an aircraft for 30 minutes to an hour, possibly.
Yeah, and that's what Sprackus, in the documentary, they proved that in that study. So when you say outcomes were better, it's way more dramatic. There was a 67% difference in mortality with the California National Guard unit compared against the active duty element that they compared themselves against. And I can't remember if it was who they ripped out with or who replaced them. I forget who they compared themselves to. A 67% reduction in mortality by having just experienced and higher trained, medics on those aircraft. And it's no joke. I mean, even now with what I do, there's a post-surgical patient with an open belly that's intubated and from traumatic or whatever. Those are no joke. It's some difficult patients, and yeah, an EMT with his eyes this daggone big, it's insane. And even folks that Ryan works with, it was a known issue that you've got higher level soft operator medics that are handing their patients off to a lower level of care. I think guys like the PJs and 160th have kind of filled that gap a little bit, but it's depending on where you're deployed and depending on what part of the country you were in at that time dictated who you got. And so it's huge. So if you guys really want to get deep into that story, the book is called Selfish Prayer. It's a great read. It's a powerful read, and toward the end of it, you kind of get your head around why, one, this isn't a really well-known initiative and study that's out there, and two, just the impact that it had on military medicine. And without guys willing to stake their careers that we would not be having a discussion of critical care flight paramedics in the military today. We wouldn't be having that.
Yep. I loved reading the book. I highly suggest anyone that is within the military, medicine, or even EMS in general, read the book. You don't have to be interested in going into the military. I've been in the military to appreciate what is talked about. They actually do talk about true medicine in the book, and not just cool guy flying, cool guy military medicine things. It's amazing. Like you said, Selfish Prayer. You can find it on Amazon. It's well worth the read. But so from that, they figured out, hey, critical care paramedics need to be in the back of aircraft. So they started standing up paramedic programs around the Army, and they authorized local bases to find local solutions. So Fort Bliss, where I was, found a solution through El Paso Community College, and they had developed a fast track program for the fire department and border patrol, and they spawned that into a fast track program for Army flight medics. And while I was never a flight medic, I got to be in a filler course that kept the program alive, basically. And 25 of us went through the course. I want to say, this is a very off the top of the head assessment, I think there's 5 of the 25 that are still paramedics. And that spawns into something later about why there's so little from that class. But so transitioning, it was very easy for me. I had my paramedic card coming out. I went through all the process to get hired with the department I got hired with, and within 3 months of leaving the Army, I was sitting in an academy, with a full-time, full-time career type job. So, Cody, what was transitioning for you like with coming out with just an EMT card?
It was easy and it was hard, incredibly difficult, because I didn't understand the civilian system as well as I should have, so that I could manage my expectations better. I was coming off of 8 years and a few deployments, and I was slinging it as far as my resume goes. That's what I thought anyway. And being a paramedic was always it was my goal, for joining the military. I wanted to be a firefighter paramedic, and I was too young to get into it at 18, and so I did my enlistment. 8 years later, that was still the goal. Interesting thing was I was looking for work first so that I could pay for paramedic school, or pay, to help support the family through paramedic school. Thank God for the GI Bill, right? And there was something like 20, 30 no's, 30 rejection letters, because medic in the Army or in the military does not translate to medic in the civilian world. That's kind of like how we've opened up the discussion, right? It means two completely different things. And I was basically aware of that. However, I didn't see the constant rejection letters coming. I didn't see that coming, and I had a good plan in place I was already accepted into school, so I didn't even have to leave Fort Hood. I was able to stay right there, so we didn't have to do a family move and then go to paramedic school and then try to get into all this stuff. I was able to find a job as an EMT basic. So interestingly enough, there's something to be said for veterans hiring veterans. So the first civilian EMS job that I had, I was hired by an old Navy corpsman, Jeffrey Mincy. I'll never forget him. I went to a job fair. I was trying to get out of doing stupid shit at the unit, so I was like, today. I actually went to the job fair that I was supposed to go to. And there was Jeff, there was his hospital system there in Gatesville, Texas. And they were like, hey, here's the guy, call Jeff and he'll hook you up. So he walked me through everything. Right. He walked me through getting my EMT basic for the state. So having a National Register card doesn't mean a whole lot to a lot of people. You can be certified, that's what that means, but you're not credentialed to work in the state until you're certified by that state. And there's very few exceptions to that rule, that you have to be credentialed in the state that you're working in. Probably 98% accuracy there, Josh.
Yeah.
It's mostly government type stuff where you may not need it, but
Yeah. So the long and short of it is you need to, wherever you're going to be, first off, we can have, this would be a whole nother discussion, even if you're retiring from the fire department, have a plan. If you are in the military right now and you're listening to this episode and you are getting out, have a plan. Okay. Those that get out without a plan have a higher chance of ending back in the military, or just, yeah. And it happens. Look, it happens, and it's daunting when you get out, even when you have a plan. But if you don't have a plan, if you just say, hey, I think I'm going to go to school, or I got a friend that's going to get me a job. No, line that stuff up before you leave. Okay. So find out where you're staying. Are you staying where you are leaving the service from? So, for example, Cody left from Fort Hood or Fort Cavazos now, and ended up in the Killeen, central eastern Texas area. Are you staying there, or are you moving back home? Find out where you're going. If you're if you're an Army medic or a military medic that has an EMT card, and contact your state EMS agency. Find out what you need to do to get a card in that state. So Texas, I'm familiar with Texas as well. Texas is actually a very simple process. Now it is. You call the state EMS agency, or state Health and Human Services EMS division. I still get their emails. Nominate your top EMS clinicians. I'm like, well, I haven't been a clinician there in a while, but and you provide a copy of your card in your training. That's what you do. And then they give you an EMT card or a paramedic card in return, and then you can apply that to wherever you're going to be. Maryland, last I checked, it was still a reciprocity process that you need to, you can probably speak to this now better than either me or Cody, because you're an educator now.
Yeah, for about 3 weeks. I would have to refer to my state EMS agency's website to address that question accurately.
But you have to go through a process. I know when I brought my EMT card from Virginia back to Maryland, this was before the Army, I had to take a state protocol test as an EMT, and I also had to take a state refresher class. I did it outside of being a volunteer. It was paid for out of pocket. It was a process, but find out what it is. Don't just show up expecting them to be like, oh, you're an Army medic. We're going to roll out the red carpet for you. I'm going to burst your bubble now. They're not going to care. Okay. Plain and simple. Do the research, know what to do, and show up prepared for this. Ryan, you got something?
Yeah, I was going to double down on that. With my experience transitioning and having to, interview as an Army medic, basically. There are medical directors that I talked to that were like, I refused to hire 68 Whiskey because I had this one guy or these two dudes or whoever that were terrible. They didn't know what they were supposed to know. And this is urgent care and the emergency room in Dallas. That both of these folks were like, I don't typically hire Army medics because X, Y. So if they're getting out, to add on to the getting out thing, being a steward of the profession, of the Army medical profession is paramount, because you're not going to get in just on, I'm a medic. It's not 2005 anymore. No one cares that you're in the military. And furthermore, we've had enough of a sample size of veterans from the GWAT to come into the workforce. And unfortunately, in this case, dilute the quality of it. And so that's something I would just tell people to be caution about. Don't just go in with your best foot forward being an Army medic. Be a really smart person. Be a really, that's something I would want to add to that aspect, because I've worked with them to where they're trash, they're garbage clinicians, but they were a medic, and that's why they got hired. That is they represent you, you represent them, you're all the same. So I would say to really have something more to offer if you're interviewing to be in the medical field. Have something more than just a title. That's what I was.
Yeah, I can attest to that. They don't care. They don't. Yep. They need certain quals. They need certain certifications. They need certain time. certain certification levels. And if you don't have it, I mean, don't take it personally. You don't have it. So just do your time. Like my time was finished up. Let's see, I did paramedic school while working part time as an EMT in a rural county service, which was, I mean, it was awesome, right? But that was there was only 8 months of EMT level experience I ever had, a
Yeah.
civilian EMT level experience I ever had. I mean, being a military medic, being an Army medic, and then thinking that, I can jump on an ambulance and I'm good to go. Kind of to Ryan's point, it's night and day. It couldn't be more different. And if you're coming with that, so the military, and you guys know this, the military kind of draws a very hard line, the same way civilians do. Right. The military draws a very, very heavy line and says, listen, this ain't civilian medicine, which is total bullshit. But this isn't civilian medicine. This is tactical medicine. This is Army medicine. This is how we do it on the battlefield. And none of that civilian stuff matters until you're a civilian. And you're having to do the civilian stuff that they told you for 8 years. It didn't matter. And man, you talk about it's a great segue into discussions on training scars, which could be a podcast in and of itself. Just training scars and bad mental models for the job. Don't get. I mean, I would ask the listeners, don't misunderstand us in saying that military service was not beneficial and that these guys should shit on because they're not this and the other thing. Don't hear that. Hear that you need to be a good dude. You can't just have been a military medic in any capacity, whether you were just a regular leg ass medic in some unit or you're one of the tippity top soft guys. It doesn't matter. You got to be a good dude and you need to be a good employee as well. And showing up with a chip on your shoulder or showing up like, I'm better than all this will not do you any favors getting hired. I think the biggest benefit, and Josh, you probably can attest to this, is your military service does give you civil service credits, provided you pass the test. I didn't pass the test, so I didn't get points.
So, and some places have preferential hiring of veterans. So when I got hired by my department, there was preferential hiring for veterans. It's like it's an extra, checkbox on your application. It's a metric. And there are departments out there that have a certain number of veterans that they try and have in every class. That's police, fire, EMS departments. They specifically cater and hire from our population of veterans because they want that within their service. But that doesn't mean that's a free ride for you guys. That means guys and girls still, as Ryan put it, be a good steward of the military and be a good steward of military medicine. Okay. Cody brought up, that coming out of the military and hopping on a civilian EMS truck is night and day different. And it is. I luckily came in with experience, but seeing the lack of experience from my fellow Army medics in emergency medicine, it just highlighted it even more. And what I emphasize to any Army medic that's listening, if we have any listeners out there that are, care about the EMT portion of your job. Don't go into your refresher classes every 2 years or your table 8s and just blow off the EMT research portion part. Blow off the medical classes. Blow off the EMS trauma classes. And only focus on the Army trauma research stuff. Okay? Don't do that. I heard it time and again when I was in it. Oh, I hate that first week of refresher because it's all EMT stuff, and I hate that stuff. It's not my job to know that. It is, and be good at it because it can produce a job and a certification that you can have coming out that can help you, sustain family life and provide a house and a life for your family, and then spawn into many other things: paramedicine, nursing, medical school, if you so choose. It can be that catalyst. So don't just disregard it, please.
What are you gonna say, Ryan?
Yeah.
Was that?
Yeah. What are you gonna say?
I was agreeing with what you're saying. Is not taking for granted what the military has given you, because not everybody knows that. Um, uh, you're talking about the lack of experience with military medical folks in the civilian side, and that's something that I don't know if I'm going to say it the way or it's going to come out the way I want to say it. Is don't just assume that everybody that you're speaking to as a medic, as a military medic person, don't assume everybody you're speaking to knows what that means and knows everything about it. And also, if you're a hiring manager, EMS official, or whatever, don't just assume that every medic that comes across your table or comes across your desk has gotten it on every time they've deployed and it's blood and guts every day. It's not the case. So they get a lot of exposure, or they should be seeking it. But I think the expectation, and veterans don't do a lot of favors for themselves by not setting those expectations. Like, hey, listen, I'm a military medic, but this isn't Vietnam, man. Like, I just did my time. Not everybody, was just blood guts every day. So just expectation management on both sides is what I would say to anybody listening to this on either side of the hiring the desk is don't make too many assumptions about what a military medic is and what they can do. And if you're a military medic, don't make too many assumptions that people just know that you're so star-studded awesome, because we are. I think overall 68 whiskeys are given kind of and Corman and all these folks are given a bad rap because we know a lot of stuff. We're very smart. You just can't prove it on paper because you're just an EMT, right? So they don't know all the things that, like my credential, I'm just an EMT basic. I know a lot more than that, but I can't prove it on paper. And that's how, like most 68 whiskeys, I feel like they might be, or they might feel inferior applying against a bunch of paramedics or whatever. They may have more street. It's certainly the case in my racket in the Guard. When we work with active duty medics in soft, those guys aren't doing medicine today. Some of them are. Some of them are working in their MTPs and their clinical sites. But as a general rule, like if you're a dude in fifth group as a medic, you're not doing this stuff every day. You're reading about it, you're training, you're watching, doing this, podcasting, but you're not doing medic stuff every day. You're training. So don't be too presumptive that every 18 Delta or SART or whoever you run across is so star-studded awesome just because they have that title. They may not have done anything either. So it's the expectation management, I think, all the way around. If you're hiring, firing, trying to get a job, trying to make a career change, it's all these things to consider about the culture of a veteran transition and what that means. That's
and for those that, just to clarify, 18 Delta, that's a Green Beret medic. A SARC is a special amphibious recon corpsman.
Special amphibious reconnaissance corpsman, which is probably the longest pipeline that nobody talks about. Incredibly hard. Yeah. Sorry about the jargon, but yeah.
Those are your special operations, like, cool guy, tier 1, tier 2 units. They're not doing medicine every day. They are highly trained, highly specialized, but it is not their primary job.
Right.
And, I'm one of those people, where on the other side of the table, I did 10 years in the military, never deployed, never left the United States, and never served overseas. And so I never did I was never in a firefight. I never provided care under fire. All the trauma care I've ever done has been civilian. I've never once, opened up an IFAC or my aid bag to treat a gunshot wound in the military. But that, the assumption is because of 10 years in the military, in the current realm that we're in, and I actually came in a little late in 2012, meant I deployed and I saw all these things and did all these things. So don't go in as both the medic, assuming that that's what they think of you, and then at the same time, for those that are, the hiring managers and as private companies, don't assume that of your prospective employee. They have a lot of knowledge.
That was a huge wake-up call for me. As my transition eventually started going really well for me. And, I was eventually on the other side of that desk, and I was hiring, and I was looking for, I was like, I want that as one of these that served. One, because I was a little, I don't want to say jaded, that's maybe not the right word, but I knew how hard it was for me. And I knew what Jeff had done for me. And I kind of wanted to pay that forward. So, if I could bring a veteran guy in and help him through school or help him through whatever transition he's going through and give him a job, at least if I can do nothing else for this cat, I can give him a job. Then I actively sought those guys. But there was a couple times I got burned, and it was just kind of like, to Ryan, what you guys have kind of been saying for the last little bit of like, listen, they came in, and the coolest thing about it was that they had been in the military. And they were not great employees. There's been times when I was employee, let's just be full disclosure. But, it's, they got out, and they were like, no, I'm better than this. I'm better than the standards. I was in the military and had higher standards. Well, maybe. That's
Did
not
that?
always the case. Did
Did that?
you?
Did
Did
you?
you? Let me look at your resume. What do you know where you in?
That's the
Yeah,
thing.
no.
That's the thing about discipline. That's the thing about discipline too. About being too presumptive is the discipline it takes to work in the civilian side versus what it takes to be doing what I'm doing. It's big difference. Like discipline in the military is getting dressed, hygiene, working out, whatever. The civilian side, it's a lot more. Like you're very very much responsible for your entire life. Whereas in the
Yep.
military, whether you realize it or not, somebody was always wiping your nose, whether you saw it or not.
In the
But
civilian
yeah,
world, you have to be an adult, right? You have to be a real adult.
Mhm.
Yeah.
Yeah.
Ken, do you have anything?
I
I know.
well, I didn't want to just throw out there, as we've been talking about this, I would really like to see us do an episode about like presenting yourself as a professional, all from applying to a job through delivering a death notification. Like, how do
Oh
we
yeah.
do that? I think that would be a great topic, and I'm sorry to derail this.
No,
No,
I agree.
that's excellent. That speaks to a lot of the maturity that is required of the career fields we're talking about in the military. There's a big difference between, I think, us and the rest of the military is maturity level. And for what you just said, Ken, that's very important, critically important to be able to communicate
Yeah.
like a
Yep.
professional. 100%.
So we talked about transitioning. We've talked about how you get into the military to be a military medic. And then here's the hot button issue. And we kind of have already kind of hit on it a little bit, but
Excuse me.
being an Army medic, being a Fleet Marine Corpsman, being an Air Force medical tech, we got all this extra training. Ryan kind of alluded to it, that there's a lot that we can do, but it's not on paper. He talked about at the beginning about having a PA or a medical provider of a higher level, either a doc or a PA, can teach us a lot of things that we can't put on paper. When I was with the infantry, I was taught to suture. I was taught to drain abscesses, inject lidocaine. Had I been with that PA a bit longer, we probably would have talked about nerve blocks, all these different things that even as a paramedic, I don't do. And I probably will never do as a paramedic. But I was taught how to do them and was expected to be proficient in them as an EMT in the Army. And there's meds that we get that are normally that are part of our formulary that are paramedic level drugs, ketamine, big time. Another one, we go straight from an NPA to a surgical crike. There is no formal, unless it's changed at Fort Sam Houston or the satellite sites, we don't talk about supraglottics a whole lot. There has been a recent conversation about how do we introduce intubation to the ground level provider that is not a special operations medic, stuff like that. But we're doing these things that are paramedic skills in the civilian side or EMTs.
Yep.
I
was intubating on my first deployment. They said, hey, we need help. We need extra hands doing this. You're capable. We're going to teach you how to do it. And I'm trained by anesthesiologists that were in our OR. And, it was pretty dope. But like Ryan said, I've been pretty on paper when I couldn't use it.
Yep. And that's something we run into a lot as Army medics and as military medics in general. And it's what leads to this belief that because you got all this extra training and your formulary included ketamine and fentanyl, and you gave antibiotics, you gave maybe depending on the job you were in, you gave paralytics and sedation, and you did RSI level of things, that, well, I'm an Army medic, I did all these things, I'm like a paramedic, I could make this jump no problem. Why isn't there a military medic level national certification? Or why can't I just walk into paramedic school and be like, hey, I only need to be here like 2 weeks. Teach me how to, read cardiology, read strips, and and I can have.
I'll say this, Josh, is you can walk into paramedic school and say that. You can say, why do I have to do X, Y, or Z? But no, you can do that. And I encourage, the Army medics that are transitioning and going to a paramedic school to walk in there and say, I have done a lot of stuff in my career. I have done these things. What can I use those experiences for from 5 years ago, from 4 years ago, to make me successful now? Right? And what can it what and I think a big piece of it is kind of that discipline and professionalism that we've kind of been dancing around a little bit of, you didn't get taught to do INDs and sutures if you were the shithead medic. If you were the dirtbag, you didn't get taught to do that stuff. So there was a level of trust that comes with competence and professionalism and developing yourself in professionalism. So if you want the cool jobs as a paramedic, you need to maintain that standard of and discipline of, I'm going to be a professional. This is what I do for a living, and somebody's life depends on my capacity for this job. So walk in there with that exact same mentality. Are you going to go back and see things that you've done before? Great. Use that to your advantage. Build your rapport with your instructors that way. Don't go in there acting like you're better than the training. Go in there and be super freaking proficient with it because you've done it 1,000 times before. And build your rapport within the class. Use those things to your advantage socially. There's so many different ways to use your military experience to your advantage. But if you walk in there thinking that I'm better than this because I was in the military, are you gonna fall flat on your face? And I had a funny thought, Josh. You talked about, they taught us how to do INDs or irrigation and drain for abscesses and things like that. How many booty abscesses did you cut out before you realized why they taught you to do it? You don't want to do it anymore. So you fought it up. They don't want to do it anymore. You're like, oh, this is awesome. And then there was one, I remember it very vividly. There was a pilonidal cyst that we did right up at the top of some guy's butt crack. And when it popped, it was the most rancid, it's the second most awful thing I've ever smelled in my life. And they're like, all right, man, you good? I was like, no, don't run it. Don't. Where are you going? Where are you going? But, I guess I'm good. And you're stuck there. You're stuck with this cesspool of bullshit. And it's only like put it. And you have to clean this up. And I realized at that moment, I was like, that's why they taught me how to do this. So they don't have to do it.
Yep. Old school PA trick.
Old school PA trick.
True. It's absolutely true. So, Josh, back to your question, you were asking, is there a need for a critical care paramedic in the Army? Is that what you're?
No.
Oh.
I believe there is, by the way, if we're going to broach that topic. I believe that there is a need for it, both at the flight level and the ground level, and the Army has recognized that. At least teaching someone to the paramedic level at the ground. With the current combat paramedic course, that is a highly debated hot topic of how do you do it, and what's the actual goal of it. But
That's it. I got a great guest for another show. I'll talk to him if he's interested. He graduated the Army flight medic course, and I think he is auditing the combat critical care something. He's doing another thing right now. He's the guy to talk to. But should have part of that as well.
But no, I mean, there is a role for it, especially with the evolving battle space that is coming on the horizon.
So that's what brought me to the question. And this might be a little bit of a complicated question. It is loaded. I'm going to go ahead and give you that. So with LISCO, you mentioned LISCO is large scale combat operations, right? That's what we're all focusing towards now. We're going from COIN or counterinsurgency, counterterrorism to large scale combat. And with that, medical logistics is a big piece of it. Logistics is always a piece of any combat operation. So we were talking about blood recently at a conference. What is the point of having 8 units of blood per soldier in theater, which is a goal? What is the point of having that many units of blood per soldier if you can't keep it cool, if you can't warm it when you need it? Because all of the systems to do that are so expensive and hard to get a hold of. Well, do we even carry blood? narcotics. Okay, now you're far forward deployed, and this is not Afghanistan, this is not Iraq, where you can fly a helicopter every corner of those countries and pick somebody up with all the stuff you need. Chances are your resupply is days, if not weeks, behind you. So the reason I ask the question is having more tools and education is great, always great, fantastic. But if your bag is still the same size with the same stuff in it, of what use is you know what I mean? You're still asked to do the same job. You're not going to get the tools to do it with. You're not going to have the evac you had before. You're not going to have the infrastructure that you had before. So you're having to do a lot of the same with a lot less. So that was something I'm trying to research and run down within our own racket too. Is like, well, why are we fielding so much, or why are we giving so much for this one pigeonhole injury they might see once? So we're like giving so much emphasis on blood and all these things, which is obviously important. But the logistics behind getting blood to the battlefield is almost, and I've cautioned what I'm about to say, is almost not worth it when it comes to fighting the battle, because we have one small piece of that thing to do, is just keep people alive. Don't get me wrong. That's our job. But there is a bigger picture, way bigger picture moving forward. So,
No,
go ahead.
Go ahead, Josh.
no, I hear you. Like that was actually talked about. We were writing that up during refresher. So I did my final Army refresher back in January of last year out in Fort McCoy out in Wisconsin. And for those that are listening, once again, that are Army medics, if you're a paramedic in the Army, in the Guard or Reserve, and you don't know about the paramedic level refresher that McCoy does, hit us up in the DMs. I will get you the information. It is a much better course to go to than your normal refresher tables, because it is taught at a paramedic level. And so we were talking about that out there because, Ukraine was hot and heavy still, obviously, and it still is. And how, we're talking about certain things with LISCO, large scale combat operations, and how do we do the logistics side of it, and why are we focusing so much on prolonged field care when we can't even have the proper equipment to do PFC? And how can you, prolonged field care is PFC, and how can you do that when you are under threat of artillery bombardment at any given time? You can't truly perform prolonged field care if you have to move pretty consistently to not become engaged, stuff like that. And I think that might be a talk that is outside the realm of this podcast, because Cody and I'm shortly removed from the military, but Cody is much longer removed from the military than I. It is an interesting topic that is being actively discussed. If anyone is interested, Euromedics, Euromedics, I think, is it European Medic?
I think it's Euromedic. I know who you're talking.
Euromedic expounds upon this daily on their Instagram. They have a podcast as well. Cool thing about them, they were a big telehealth resource for Ukrainian providers during the beginning of the invasion. They were using their Discord server to connect providers with Ukrainian providers that needed assistance. It was pretty interesting. But I think that's a bigger talk. I mean, I think critical care does fall into that, and it does have a role, or just a paramedic in general.
Well, there's elements of there's pieces and bits and parts of critical care or community paramedic or whatever it is, whatever that's like this paramedic thing you want to pick from, and all of those at some point in your career as a military medic will, if you get the training, you will be an asset in that situation. You're going to get critical care training and knowing how to run vents and knowing how to do drips, or at least drip calculations and things like that. You're not always a frontline guy. I will tell you that you're not always assigned to a frontline unit where you're doing motor pool on the Mondays and you're going, what am I doing medic stuff? And then you get deployed and you're going, all of a sudden I'm doing medic stuff. Sometimes you get into units where you're in the ER of a Role 3 combat support hospital, and you're knowing how to run a ventilator, knowing how to run pumps, knowing how to do that stuff makes you more of an asset to your unit and to your team. And then you can in turn teach that. Which I think is the beauty of the military, right? So if you know something and you're a subject matter expert, you can train your entire team in how to do it. You don't have to go through all this bullshit credentialing of we got to sign off Joe and Jim and get them signed off by someone. It's the great thing in the military is if you could be taught it, and somebody's willing to verify that you've been taught it, then you can do it. And so take advantage of all the training, whether or not the military needs critical care paramedic training or not. I think there's some debate that can be had there, and you're going to get 51-49 one way or the other. On Tuesday you'll get 51 one way, on Wednesday you'll get 51 the other way. I think do it anyway. Do it anyway. Don't wait for the military, or don't wait for your unit, your organization, your company, your fire department, whatever, to say, yeah, we need this, and okay. This is an initiative that we have now. Be ahead of the game. Be ahead of the curve, and be an asset that much sooner.
Yeah. And real quick, just to clarify one of the terms, Cody said Role 3, combat support hospital. So Role 3, imagine any hospital that you would transport to in the civilian sector. It's got your ER set up. It's got a holding area. It's got an ICU, surgical suite, radiology, psych, religious services, dental, lab, all of that. It can be in a hard stand structure. So Afghanistan, these were built into hospitals at Kandahar, Kabul, all over the country, or it can be straight up a tent hospital. They are trained to do that. Think of MASH. If you want a thought of what this looks like, think of MASH, the TV show. Great TV show. If you haven't watched it, if you're listening to this podcast and you haven't watched an episode of MASH at some point, you need to fix yourself.
An emergency.
Yes. And so that's to give some
Lone
correlation.
Star 911. What's wrong with you animals?
I'm leaving.
But yeah, we jumped into a whole nother topic.
I realized as I was asking that question, not the right forum, but you brought something up that was super. It's just been something on my mind. We went to a conference a couple of weeks ago, and that was just kind of an eye-opening. Like, wow, I never thought about what our jobs are on the battlefield, and what is expected of us. And I don't get you wrong, it's not really a whole lot. For at point of wounding, it's not a whole ton that they expect. They ask a lot. There's not a whole lot they expect. That makes sense.
Yeah. But to your point, Ryan, even on the civilian side, there's a lot of organizations that they think they're playing catch up by trying to launch blood on board initiatives, or blood on the lieutenant's vehicle, or what. And then all the clinicians are like, we need blood, and it becomes these little pithy little topics that you hear them at all the conferences. Like, well, if we had blood, I wouldn't have this problem. Well, then they get blood, and then the next day they're bitching because, oh my God, this is such a pain. Why do I gotta do all this stuff?
You just described Raboa. That's amazing. It's awesome. Well, keep it clean and keep them alive after you're done. So
yeah.
It's crazy. Don't forget logistics.
That's another wonderful topic that a lot of people are debating.
Yeah.
And to kind of spin this into coming out of the military as a medic, being a paramedic, getting your paramedic, recognize that as an Army medic, especially depending on the jobs that you've done, maybe there's certain fields within medicine that you're going to enjoy a lot more than others. Okay. The only job, there's not just one job you can do coming out of being an Army medic going into EMS. You don't have to go and ride the private 911 ambulance and doing interfacility transfers. You don't have to go and work in the fire department and be doing 911 or do private third party, third service level EMS doing 911 calls. You can go work on an oil rig. You can go work out in the oil fields, and be a contract EMT or paramedic. Go find that niche job that is going to play to your cards best. Are you that person that likes to be out by yourself, being the sole provider? Then there's jobs for you out there. They're guaranteed. I know I'm throwing out to a lot of people here today. Shade Tree Cardiology on TikTok and Instagram. He went from being a 911 medic to being an oil rig medic, and hearing what his experiences are and what he does on a daily basis, if you were a sick call medic, if you worked in sick call and you also then deployed in, were a infantry grunt medic, that's the job that you're going to enjoy. You're by yourself. You're making your decisions. You're using telehealth to help base things that you're doing. Does it require becoming a paramedic? Yes, typically it does. But it's a job that you're going to enjoy. So don't just feel as though you have to be, consigned to this one field in EMS. There's so many things that we do, and it's an ever expanding thing. You can go and then
paramedicine, right?
community paramedicine. You can go and do contract work as a medic, or do humanitarian work as a paramedic. You can go be a paramedic on a cruise. I just saw someone came across my feed today that her whole page is about being a paramedic for a cruise ship. There's so many
what
things.
certification I'm going after next, Josh? I'm going after my cut man certification. I'm gonna be a cut man for UFC.
That's the way to go.
That's what I'm gonna do. Because I think it's such a cool point to bring up, Josh, and Ken and Ryan, all of us. I mean, I want all you guys to weigh in on this. There's a spectrum of paramedicine. There's a spectrum of pre-hospital or out of hospital care, and my fear is that our generation of medics, they pigeonhole themselves into believing that your life has four wheels in a box, and then the best thing you could hope for after that has rotors on it. And that's not the case. It is not the case. You could go work in the cath lab. You could work as an anesthesia tech. There's a whole spectrum. I mean, what's the coolest job that you guys know of as a paramedic, as a civilian paramedic? Don't cheat off me. Don't borrow from me.
Other than me, Cody Winniford.
No, I think probably and I think it is a broad question because it depends on what you think is cool. I would have to say possibly maybe like a backcountry medic. You're on a search and rescue team out in middle of nowhere, South Dakota, Montana. And I can't think I saw the show. I don't know where it was. I want to say it was like Idaho or Montana or Wyoming, where they do backcountry ski rescue. They do ATV rescue. They have a helicopter. They've got the traditional four wheels and a box. They do it all. And it's this search and rescue company out in the middle of nowhere. And the stuff that
that's where I'm going.
Actually, Mesa, Utah. So right there outside of Arches National Park, their service does search and rescue. It does four wheels in a box. It does helicopter. It does critical care. And they're going out into the backcountry of Mesa and Arches and Canyonlands and grabbing guys that have fallen while rock climbing or have been lost in the woods for X amount of days. That sounds like a pretty cool job. Yeah. Honestly.
Talk to us about being I never say the same thing.
Contractor, wildland firefighter. Yeah. So when I was doing that, so I started that in 2009 when I got out, and to 2015 basically was when I was doing that job. And I saw, of course, in California, you would have the local fire departments, like Kern County would roll out their whole, all their medical people, and they'd have a trailer. So you go get shots for poison oak, ouchie, boo-boo stuff. And now I think they have companies that contract with the incident management teams to actually travel with the incident management team organically to just do all of the incident medical stuff. And traditionally on a crew, you have an EMT or a guy that knew how to do some stuff. And he would carry an aid bag of sorts, first aid kit. But there's been incidents where guys have been hit by fallen trees, have had some very severe trauma up there on the line, and they've unfortunately, a lot of those guys have perished because of how long it takes to get up to them and get out. But I think now they've actually had these dedicated contract crews that travel around the country, the western part of the country in the summer to do that.
And I want to real quick correct. It's Moab, Utah, not Mesa. Moab.
Okay.
Sorry. Ken, what do you think the coolest job outside of four wheels in a box or a rotor is?
So I do like the oil rig thing. I actually early on in my career applied for something very similar at some sort of it was like a construction type gig somewhere.
Mm-hmm.
I don't remember the specifics of it. So I do like that. But I still worry that we're going to get into a bigger conversation here, but even with all these cool options that are out there, you're still pigeonholed into pretty much doing the same kind of stuff no matter what. And once you hit another level, that's it. There's nowhere to go. There is no, paramedic version of the nurse practitioner or the physician's assistant right now, right? We don't have that terminal degree. So, and I just worry that we can bounce around from cool stuff like I just did in my personal life. I bounced from one cool job to another, and but there's still a ceiling there, right? So I don't know. Not to bring the tone down.
It's very unpopular, but I think, at least I know my experience, Cody can attest to this a little bit. Some people we know that the answer to that question is being an RN, and that's a shitty way to go, but it's the right answer. It's RN school, man. No, it does suck that there's not a higher. It is unfortunate that there's not a higher level for a paramedic to do what you're talking about. It's kind of have that career field as its own pre-hospital managed provider, if you will. Instead of having to rely on a PA or a nurse practitioner. Yeah, it's unfortunate.
Yeah, I brought it up with the team recently, and this is going to spawn into another episode in the future. But that point where you still love what you do clinically. Like I'm doing it for 17 years, and I love it. Still to this day, I love clinical medicine, and I don't foresee myself not loving it. But I also know that I want to promote, and I'm going to get away from clinical medicine. And that, how do I still stay within that? Or what is the opportunities for someone like myself that maybe isn't in a fire department or a paramilitary organization that wants to do more with the knowledge and education that provided, but still stay within the clinical realm?
So, Josh, you're 17 years in. I mean, how do you keep the love? Because I think that's the part that really a lot of us don't talk about. Right? Like I'm pro advanced practice and getting degrees and all that kind of stuff. Of course, I have to go get my master's to be on board with it. Whatever. But so what is it? So how have you stayed in love with the job for 17 years?
I'm not going to say that it was easy. I definitely have been handed a hand of good opportunities throughout my time doing this. And I wasn't doing it, every day for 17 years. I got into it in 2007 as an EMT and was a volunteer, and I did casual labor with, other departments, and I was in the Army, and then, now I'm in a career fire department. But for me, it's just, it sounds so corny sometimes when you say it, but like it's actually getting to affect that direct care on a person every day.
Yeah,
Like,
yeah.
some days,
It's not
some
corny,
days
man.
suck. Look, some days suck straight up. You're just running the BS calls. You're dealing with patients that don't like you. You're dealing with hospitals that are not liking you that day. And it's just a bad day. It happens. It happens all the time. But it doesn't, for me, it's not the sole atmosphere of what I've been doing, I guess. Not atmosphere. I don't know. I'm blanking on a word for it, but it doesn't embody what I do. Like the days where like you get to do that, like those cool interventions, or you have those crazy traumas, those big time medical calls, or you just straight up get to influence someone's day positively. Like
Right.
that. I mean, I harp on it at work that, from 7 a.m. to 7 a.m., this is our job. This is where we are. They want to go to the hospital. We're going to go to the hospital. They want to take their time getting out to the ambulance. They're going to take their time, and we're going to run each call as it comes. And we're just going to try and learn from it. I don't know if I fully
Well, no,
answered.
it comes back to be a good dude,
Yeah.
right? If you want to enjoy your job, be a good dude, right? It costs you nothing to be nice to to the lady that's shuffling to the door and you're gonna walk to the stretcher anyway and load her up. It costs you nothing to just be nice and enjoy that moment and have fun with her. Be like, come on, Granny, we gotta go. We got stuff to do today. You know what I mean? Like, just have fun with it. I mean, don't insult the customer for
No.
letting you stretch imagination. But Ken, you were in the big city, man, for a long, long time. How did how did you stay there? How did that? How'd you keep that good mental sight picture?
Yeah, so a lot of it goes back to what Josh said about just enjoying patient care for me. Like, I really like being a paramedic who's there with somebody who is sick, who I can put my hands on them and affect change and hopefully have a good outcome for them. I never lost that, from the time I was a paramedic when I then transferred to the academy for a while. And I was miserable there because I didn't have any patient contact. So I promoted, went back to the field, and went out of my way to jump on calls where I knew there was going to be some patient contact that I could get involved and affect change for somebody. I think that's so important. And fast forward a month later from me leaving my job, um, that is one of the few things I miss is putting hands on patients. I mean, I still volunteer, but the volume isn't the same, so it's not the same thing really for me. But yeah, that's my
Yeah,
2 cents.
So what I hear, and Ryan, I'll give you a shout in a second. Like, so what I hear, if you don't like, because every now and again I get something comes across the old social media feed where I'm like, why are you doing this? Why do you have a whole identity built around shitting on the profession? Like, if you don't like taking care of people, don't do this job.
Right.
That's what I'm hearing. If you want to be happy for the long term and you want to enjoy being a paramedic for the long term, you have to like people. You have to like touch. Ooh, I don't want to say touching people. That got me in trouble in Las Vegas last year. Not touching people, but saying that.
Yeah.
It's a funny story. It's a hilarious story. I can tell it at the end. But if you don't like taking care of people, if you don't like attending to people's needs, which that's up to them. It's not up to you to dictate what's a need. If you don't like doing that, then go be a nurse. I mean, or go. Sorry, go be uh, go be
Go be a hospital administrator.
There you
There
go.
you
Oh yeah,
go.
Yeah.
there you go. Get your MBA and go work in the C-suite. Then you can shit on the world if you want to. Yeah, you can exact your revenge on society for you being alive. What do you think, man? What's your take on this?
Empathy is just plain old empathy. I just feel for people. But I don't do clinical medicine at all. And quite frankly, I don't think uh, I'm a better teacher than I am a doer. So, but it's empathy. I was given some really awesome, just a small piece of advice years ago, and it came up in patient care, and it was a very, I'll get into it on another time. It's a very profound moment for me. And so that's my passion, is just like, if I teaching and finding people that are struggling or not quite, contextualizing what they're doing. It's like, hey, it's a person at the bottom of your hands that you're dealing with. They have feelings, they have a heart, they have a mind, they have all those things. Whether they're showing it to you or not, they have a heart. And I don't know, I've just always felt our mother is that way, very empathetic person. I think I got that quality from her as far as caring for other
Different mothers.
people. Definitely different points of view. But yeah. No, it's just empathy. It's old school. I give a shit about people.
I mean, I think we covered a wide range of topic here, from military medicine to how do we stay in the game for so long, and how do we enjoy this. But to sum it all up, if you enjoy medicine in the military And it can be tough to enjoy it at times, depending on what your job is specifically within the military, within your unit and role. There is a place for you outside of the military in another job and another career. Okay? You don't have to just stay in the military. If you want to, go right ahead. We need those people. I was not that person. Cody was not that person. Ryan is that person. He's spending a lot more time in the military than we are. But come out and come with the right attitude into this profession, into this career, into this realm, and make it the best you can, and try and enjoy it as best you can. Look to others to find out how to enjoy clinical medicine and why it's so enjoyable. Hopefully you find that in your training and your experiences. And just use your time in the military to best set you up for either the rest of your career in the military or the career you're going to have after the military. Okay? Whether that's having that card in hand, or it's making the right choices, going to the right places, talking to the right people, accepting life as it happens. That's what I had to settle with. Not settle. That's what I accepted in my life. I couldn't. I left Army ROTC in college after 4 years and enlisted in the Army, and the process that took. All these things led to where I am today, and understand that we all have our own journeys, and make sure that we best set ourselves up for a good journey in the end. So, any last thoughts and words, guys?
No. I appreciate you guys having me.
We appreciate having you on too, Ryan.
No.
It was like having the Winniford boys on.
Yeah, absolutely.
No,
I think there's
I'm not gonna do it.
I think there's some opportunities for some good, at least some comedic podcasts in the future.
Yeah. Ken, you got anything?
No, just want to say thank you, Ryan. It's been a great talk.
Yeah, appreciate it, Ken. Thank you.
Cody, you good?
Yeah. Hey, I'll say this, gentlemen, thank you for your service. Thank you for what you've done for the country, what you continue to do for your communities.
Well, no problem.
Yep. Out of here.
Yeah. So, okay. I guess I'll take us out. Or Ken, do you want to take us out?
Doesn't matter to me, Josh. Whatever you want to do.
Okay. I'll take us out. So, wherever you're listening, thanks for listening. Good evening, good night, good morning. I know that's out of order. Make sure you follow us on Instagram if you're not already. Lots of stuff constantly coming from there. Thank you for everyone that is following us, everyone that is giving us suggestions. To John, the paramedic, I'm going to do a little shout out. Buenos dias. For some of our international followers, he's down in Mexico. He's reached out to us to show his support. Hopefully he hears this at the end of this episode when we get it up on YouTube. And wherever you are, be safe and see you.